If you're a new parent, oh, you know the feeling. You open that diaper, and suddenly a million questions are racing through your head. Is this normal? Is that the right color? Are they eating enough? For something so small, a newborn's diaper can be a huge source of worry.
So let's dive right into this, because the answer is a lot. Seriously, that little diaper is one of the best tools you have for understanding your baby's health and hydration in those first critical days. It's not just waste, it's data.
And you're so not alone in wondering about this stuff. So in this explainer, we're going to break it all down, day by day. The goal? To help you feel less like a stressed out detective and more like a confident parent who knows exactly what to look for.
Okay, first up, let's talk about a timeline, because that first week, it is a whirlwind of rapid change. And that is especially true for what you're going to find in that diaper. Trust me, what you see on day 1 is going to look totally different from what you see on day 5, and that's actually a really good thing. So check this out, because there's a really cool pattern here. Notice how the number of wet diapers kind of matches the day of life for those first few days. 1 on day 1, 2 on day 2, you get the picture. At the exact same time, you'll see the stool change from that sticky black stuff called meconium, which is totally normal, by the way, to dark green, then a lighter green, and finally, it lands on that classic mustard yellow color by the end of the week.
Yeah, seeing poop go from black to green to yellow can be a little jarring if you're not expecting it. So it's no surprise that one of the top questions parents have is this crazy color change really okay?
Yes, 100%. In fact, it's amazing. This transition is proof that your baby's digestive system is waking up. It's processing that first milk, and it's clearing out all the material that was in their gut before they were born. So it's not just normal, it's a fantastic sign of progress. So that timeline is kind of our roadmap for what should be happening. But how does all of this connect to feeding? Let's connect the dots, because those diaper changes are honestly the best evidence you have that your baby is getting enough milk.
And this is so important. While stool can vary a bit, the urine output is your most reliable indicator. Why? Well, it's pretty simple. What goes in must come out. If a baby is well hydrated and getting enough to eat, their body is going to produce a steady stream of wet diapers. It's really that straightforward.
Now, to get that steady output, you need consistent input. The recommendation is to aim for about 8 to 12 breastfeeds every 24 hours in those early days. All that frequent feeding helps establish your milk supply and make sure your baby gets all the hydration they need to produce those wet diapers.
And this is the magic number. After day 5 or so, you're looking for 6 or more really wet diapers every single day. Hitting this number is a huge milestone. It's a clear, tangible sign that feeding is going well and your baby is doing great.
Okay, let's tackle another super common question, especially for you breastfeeding parents out there. The stool can look surprisingly loose, sometimes kind of seedy, almost watery. And it's so easy to start wondering, is this diarrhea? Is their tummy upset?
And the answer is a big, reassuring yes. That is normal. The consistency of breastfed baby poop is just naturally very soft. That seedy texture, the one people compare to mustard, perfectly normal. This is really different from true diarrhea, which would be way more frequent, unusually watery, and probably come with other signs of being sick. All right, so while almost everything you're going to see is totally fine, it's also really important to know which signs to look out for. This isn't about causing panic, it's about being informed so you can feel confident if you do need to make a call.
And the best way to think about these signs isn't as panic buttons. Think of them more like little flags that just say, hey, maybe it's time to check in. A drop in urine output, for example, is just the earliest and clearest signal that your baby might need a little extra help with feeding.
Okay, so here are the specifics to watch for. Fewer wet diapers than that timeline we talked about. Any brick red stains in the diaper after day 3, because that can be a sign of dehydration. And notice the context on this next one. No stool for a few days is really only a concern if it's combined with poor feeding. And finally, if your baby is just super sleepy and not waking up for feeds, that's always a good reason to call the doctor.
We've covered the whole rainbow of normal colors. But are there any specific colors that should make you pick up the phone and call your pediatrician right away?
Yep, there are 3 main ones. White or a very pale, chalky-looking stool could signal a liver issue. Black stool, after that initial meconium has already passed, could be a sign of digested blood. And of course, any stool that has streaks of red blood in it should get checked out. These are the exceptions to the rule, and they always deserve a professional opinion.
Okay, we've gone over a ton of information, I know. So how do we boil this all down into a simple daily practice that can just give you some peace of mind? Let's build your daily reassurance checklist.
Honestly, it really just comes down to these 3 things. Number 1, keep a simple tally of wet diapers. Number 2, focus on offering those frequent feeds. And number 3, pay attention to your baby. Are they alert when they're awake? Are they actively and effectively sucking when they eat? If you can say yes to these 3 things, you are on the right track. So what's the big takeaway from all of this? Well, think of those diapers as your baby's very first report card. And the good news is, most of the time, they are passing with flying colors. That consistent pattern of wet and dirty diapers is one of the most powerful signs you have that you are doing an amazing job and your baby is thriving.
This explainer was based on the Guide to Newborn Urine and Stool from BePeace.in and was medically reviewed by pediatrician Dr. Mahesh Yadav.